You have a cut. Does it need stitches? You twisted your ankle. Should you head to the ER? When you have a medical need, but it's not really an emergency, what should you do? Where should you go? Holly Harmon is here to prescribe the best path to take. Holly is a certified nurse practitioner in the emergency department at MetroHealth. Welcome to the show.
Hi, thank you.
Now, we're going to talk about express care. That sounds like fast. So let's slow it down a little bit and talk about what is express care exactly.
Okay, well, express care is in between your doctor's visit and needing to go to the emergency room. So it's something that's not as life-threatening. As you know, there's multiple times when an urgent issue comes up. It's, your doctor can't see you that day, or it's after hours, and it's something you want to take care of quickly. But I don't really need to go to the emergency room, but where can you go? That's the express care.
Okay.
And at Metro, we have express cares. And when you walk in, it's a walk-in basis.
Okay.
You get seen, and you're able to get back to your life and your friends and family.
Which is really important.
Exactly. Getting out and getting done.
So what are some ideas about when it's appropriate to go to express care as opposed going to the ER? So let's talk about the ER first. When are those times most important for you to get to that emergency room?
Well, first of all, let's talk about calling 911 first for anything that you feel is life-threatening. So your chest pains. In women, heart attacks actually can show you more like a jaw pain, arm pain, or abdominal pain. So those are things that you would be concerned about. And also stroke-like symptoms. So you think of fast, facial droops, arm drift, weakness on one side, slurred speech. Time is of the essence. So you definitely need to call 911 for those kind of things. But other things that you want to go to the emergency room for: difficulty breathing, sudden loss or blurred vision, any kind of fractures, bone fractures actually need to be seen at the ER for more than one reason. We need a splint, and sometimes you actually need surgery. You need the orthopedic specialist to actually put the bones back in place.
Okay, so we know that's the ER part of it. Now, how about what are the kind of categories of or types of things we could just go to express care?
Okay, well, express care, it's for conditions that aren't life-threatening. You don't need to see the emergency room, but it's something that can't always wait until your doctor's able to see you. So some of those would be minor burns, injuries or cuts that actually need to be repaired with suturing, your sprains and strains, like you pulled something in your back or something, doing heavy lifting. So your upper respiratory infections, your coughs, your colds, your sore throats, any kind of ear infections, allergic reactions that are mild, fevers, flu-like symptoms, and rashes, irritations, infections of the skin we normally see, and stuff like dental pain would be something that you could definitely go to the express cares for.
Okay, so what if you go to the express care but you made a mistake? You really needed to go to the other.
Absolutely, and it does happen. So if you do show up to the express care and it's something that they can't accommodate, they'll actually get you to the local nearest emergency room.
Okay, so you said MetroHealth has express care sites, so where are those?
So we have 6 of those sites, and if you look, you'll see that we have them in Beechwood, Broadway, Brunswick, Middleburg Heights, West Park, and Westlake. And if you look, you can actually go online to metrohealth.org/expresscare, and you'll be able to actually look up the hours, the locations, and actually you can see the wait times, which is pretty nice.
Okay, I'm assuming you're seeing the same doctors and nurses as you would ER or express care, right? You're still getting good care.
Right, exactly. So if you go to express care, you're actually going to see the same type of individuals that you would see at the emergency room. So you still have your doctors that are in primary care. You'll see physician's assistants, and you'll also see nurse practitioners that actually are family nurse practitioners.
Okay, great. If you can't wait for a doctor's appointment, but you don't really need the emergency room, you can express yourself by visiting MetroHealth's Express Care. To find out more, use the information that's coming up next. My thanks to Holly for expressing this information so well for us today.
Thank you for having me.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org. Next.